HIV stands for Human Immunodeficiency Virus. It is a virus that specifically targets and attacks the body's immune system, which is our natural defense against illnesses and infections. The immune system is a complex network of cells, tissues, and organs that work together to protect the body. When functioning properly, it helps us fight off infections and stay healthy. However, HIV weakens this system by attacking and destroying important cells that coordinate the immune response, making it harder for the body to fight off infections and diseases. Over time, if left untreated, HIV can severely damage the immune system, leading to a significant reduction in the body's ability to combat illnesses. This weakening of the immune system can eventually lead to AIDS, which stands for Acquired Immunodeficiency Syndrome. AIDS is the most advanced stage of HIV infection. When someone has AIDS, their immune system is so compromised that they become vulnerable to opportunistic infections. These are infections that take advantage of the weakened immune system. Opportunistic infections are illnesses that would not normally cause disease in someone with a healthy immune system but can be very serious or even life-threatening for someone with AIDS. It's important to understand that HIV and AIDS are not the same. HIV is the virus that causes the condition, while AIDS is the final stage of the infection. People with AIDS are very vulnerable to a range of infections and diseases that their bodies would otherwise be able to fend off. These infections can include bacterial, viral, fungal, and parasitic diseases, which can be particularly severe and difficult to treat in someone with a compromised immune system. HIV is a serious condition, but it is not a death sentence. With proper treatment and care, people living with HIV can manage the virus and lead long, healthy lives. Antiretroviral therapy, ART, is the standard treatment for HIV. It involves taking a combination of HIV medicines every day to control the virus and prevent the progression to AIDS. Early diagnosis and treatment are crucial for managing HIV effectively. The sooner someone starts treatment, the better their chances of maintaining a strong immune system and preventing the progression to AIDS. It's essential to differentiate between HIV and AIDS. HIV is the virus that attacks the immune system, while AIDS is the condition that develops when the immune system is severely damaged by the virus. Understanding the difference between HIV and AIDS helps in recognizing the importance of early intervention and continuous treatment to manage the virus effectively. AIDS is the most advanced stage of HIV infection, characterized by a severely weakened immune system and the presence of certain defining illnesses. By understanding the distinctions and the importance of treatment, we can better support those living with HIV and work towards reducing the impact of this virus on individuals and communities. HIV transmission occurs when certain bodily fluids from an infected person enter the bloodstream of an uninfected person. These fluids include blood, semen, vaginal fluids, and breast milk. HIV can be transmitted through unprotected sexual contact with an infected person, sharing needles or syringes with an infected person, and from mother to child during pregnancy, childbirth, or breastfeeding. HIV cannot be transmitted through casual contact like shaking hands, hugging, or sharing utensils. It's important to remember that HIV transmission requires contact with specific bodily fluids. Many people with HIV experience flu-like symptoms within 2 to 4 weeks of infection. These symptoms are often mild and can be mistaken for other illnesses. Common early symptoms include fever, headache, sore throat, swollen lymph nodes, rash, and muscle aches. These symptoms usually disappear within a few weeks. After this initial stage, HIV may not cause any noticeable symptoms for several years. This is why it's crucial to get tested for HIV if you think you may have been exposed to the virus. HIV infection progresses through 3 main stages, each with distinct characteristics and implications for the individual's health. First, acute HIV infection. This is the earliest stage, occurring within 2 to 4 weeks of exposure to the virus. During this period, the virus multiplies rapidly, and the body's immune system responds by producing HIV antibodies. Flu-like symptoms may appear during this stage, such as fever, sore throat, and swollen lymph nodes, but not everyone experiences them. These symptoms can be mild and easily mistaken for a common cold or flu. Second, chronic HIV infection. This stage can last for many years, even decades, with proper treatment and care. During this phase, the virus continues to multiply in the body, but at very low levels. During this stage, HIV remains in the body but replicates at very low levels. People may not show any symptoms or may experience only mild symptoms, which can make it difficult to know they are infected without testing. People may experience no symptoms or mild symptoms, such as fatigue or minor infections. Regular medical checkups and monitoring are crucial during this stage to manage the infection effectively. Third, AIDS, which stands for Acquired Immunodeficiency Syndrome. This is the most advanced stage of HIV infection. It occurs when the immune system is severely damaged and the body can no longer fight off infections and diseases. The immune system is severely damaged, making the body highly susceptible to opportunistic infections and certain cancers. Without treatment, people with AIDS typically survive about 3 years. It's important to note that with early diagnosis and effective treatment, HIV can be managed effectively, and the progression to AIDS can be prevented or significantly delayed. Antiretroviral therapy, ART, helps keep the virus under control and allows individuals to live long, healthy lives. Regular medical care, adherence to treatment, and a healthy lifestyle are key to managing HIV. Support from healthcare professionals, family, and community can make a significant difference in the lives of those living with HIV. Section 5. Testing for HIV. Getting tested for HIV is the only way to know for sure if you have the virus. Testing is simple, confidential, and widely available. The most common HIV test is a blood test that checks for HIV antibodies. Antibodies are proteins the body produces in response to infection. Rapid HIV tests can provide results in as little as 20 minutes. It's important to get tested regularly if you are sexually active or share needles. Early diagnosis is crucial for starting treatment and preventing the progression of the virus. Section 6. Treatment with antiretroviral therapy. There is no cure for HIV, but with effective treatment, people with HIV can live long and healthy lives. Antiretroviral therapy, or ART, is the standard treatment for HIV. ART involves taking a combination of medications daily to suppress the virus. RE works by reducing the amount of HIV in the body, protecting the immune system from further damage, and preventing the progression to AIDS. ART is highly effective in managing HIV. When taken consistently and as prescribed, RT can suppress HIV to undetectable levels in the blood. Section 7. Preventing HIV transmission. Preventing HIV transmission is crucial for protecting individuals and communities. It involves a combination of strategies that work together to reduce the risk of spreading the virus. There are several effective ways to prevent HIV, and understanding these methods is key to maintaining public health. Practice safe sex by using condoms consistently and correctly every time you have sex. Condoms act as a barrier to prevent the exchange of bodily fluids, which is a primary way HIV is transmitted. Get tested regularly. Knowing your HIV status allows you to make informed decisions about your health. Regular testing can help detect HIV early, which is crucial for effective treatment and preventing further transmission. Don't share needles. Use sterile needles and syringes for injecting drugs. Sharing needles can easily transmit HIV and other bloodborne infections, so always use clean equipment. Consider PrEP. Pre-exposure prophylaxis, or PrEP, is a medication that can significantly reduce the risk of HIV infection in people at high risk. PrEP is highly effective when taken as prescribed and can be a powerful tool in HIV prevention. By following these prevention strategies, individuals can significantly reduce their risk of contracting or transmitting HIV. It's important to stay informed and proactive about your health to protect yourself and others. Section 8. Early diagnosis, effective treatment, better outcomes. Early diagnosis and treatment are crucial for managing HIV effectively. When HIV is diagnosed, early treatment can be started sooner, preventing further damage to the immune system. The risk of transmitting HIV to others is significantly reduced. People with HIV can live longer, healthier lives. It's essential to overcome any fear or stigma associated with HIV testing, and seek medical care immediately if you think you may have been exposed to the virus. Section 9. HIV's global impact and mental health. HIV continues to be a significant global health challenge. Millions of people worldwide are living with HIV, particularly in sub-Saharan Africa. Living with HIV can also have a significant impact on mental health. People with HIV may experience stigma and discrimination, depression and anxiety, and social isolation. It's crucial to address the mental health needs of people living with HIV and provide support services to help them cope with the challenges they face. Section 10. Research and community support. Significant progress has been made in HIV research, leading to more effective treatments and prevention strategies. Ongoing research focuses on developing a cure for HIV, improving existing treatments, and finding a vaccine to prevent HIV infection. Community support plays a vital role in the fight against HIV. Organizations worldwide provide testing and counseling services, treatment and care for people with HIV, and education and awareness programs. By supporting these organizations and engaging in advocacy efforts, we can contribute to the global response to HIV. Section 11. Breaking down stigma, building understanding. Stigma and discrimination continue to be significant obstacles in the fight against HIV. Stigma prevents people from getting tested for HIV, disclosing their status to others, and accessing treatment and care. We must challenge misinformation and promote accurate information about HIV. By breaking down stigma and building understanding, we can create a more supportive and inclusive environment for people living with HIV.